Hello, my name is Lisa Jablonski, and this is my case study on lymphedema for advanced procedures. So, first of all, my case study subject, I chose Kathy Bates, born on June 28th, 1948, so she is age 72. She is female, postmenopausal, multi-award-winning actress. You've probably seen her in the films like Misery, Fried Green Tomatoes, Titanic, The Blind Side. She's been in many wonderful films. She was diagnosed with ovarian cancer in 2003 and breast cancer in 2012. Her treatment was with chemotherapy, radiation, steroids, double mastectomy, and lymph removal. There was removal of 19 lymph nodes from her left armpit and 3 from the right armpit. Therefore, because of the lymph removal, she developed secondary lymphedema in her arm because of the lymph removal. Her symptoms were that one arm was larger than the other. That arm had swelling, heaviness, soreness, aching, and it was painful to the touch. There were also lumps under the skin that were not there before, and she also had difficult mobility, pain in the abdomen, and fatigue. Now she's an advocate for awareness and treatment of lymphedema. She's very active now. She's on TV and she's out giving speeches to make more awareness for lymphedema and to raise money for treatment and hopefully get a cure for this disease. So what is lymphedema? First of all, we have to know about the lymphatic system. The lymphatic system is part of the immune system, so it's very important. It is a network of vessels and glands throughout the body that help fight infection and remove excess fluid. And in that lymph fluid, there's toxins and there's waste that need to be excreted from the body. That's very important. Lymphedema is a long-term chronic condition. It is a swelling caused by a buildup of lymph fluid in the body's tissues. It can affect any part of the body, like hands, fingers, feet, toes, the breast, the chest, shoulder, armpit area, but it is most common in the arms and the legs. It develops when the lymphatic system does not function properly because it's damaged or there's blockage. The blockage prevents the lymph fluid from draining well. It can be caused by genetics or hereditary, cancer treatment, an infection, an injury, inflammation of the limb, or lack of limb movement. There are 2 types of lymphedema, primary lymphedema and secondary lymphedema. The primary lymphedema, that's caused by genetics and it's hereditary. The secondary lymphedema, that's caused by cancer treatment, infection, injury, inflammation of the limb, or lack of limb movement. There are 4 stages of lymphedema: stage 1, stage 2, stage 3, stage 4. Stage 1 and 2 are reversible, but unfortunately, stage 3 and 4 are not reversible. Symptoms of lymphedema: you get swelling of body parts like the arms, legs, hands, fingers, feet, toes, chest, shoulder, breast, chest, and the armpit area. There's a feeling of heaviness or tightness, restricted range of motion, aching and or discomfort, hardening and thickening of the skin called fibrosis, repeated skin infections, folds developing in the skin, wart-like growths developing on the skin, fluid leaking through the skin, or dry, cracked, flaky skin. The ultrasound. Ultrasound is the best modality for diagnosis and treatment of lymphedema. And it's the best because it's low cost, it's readily available, very easy to find. There are cross-sectional images, which are very helpful. You don't just get a few images. There are many cross-sections of whatever body parts that the ultrasound is doing. So you get a very good look at all around the body part with cross-sectional images. It's non-invasive. There's a short time frame of the exam. Ultrasound is usually 30 minutes or less. It can differentiate cystic, solid, fluid, and complex tissues. So it is excellent at differentiating the lymph fluid, lymph nodes, lymph vessels, and the blockages. Prognosis and treatment. Unfortunately, there's no cure for lymphedema right now, but it is not fatal, and people can live long, productive lives with treatment and managing the symptoms with lifestyle changes. Treatments include wearing graduated compression garments or multi-layer bandaging, taking good care of your skin, moving and exercising regularly, a healthy diet and lifestyle, avoiding hot and humid places, avoiding places that are pressurized like airplanes, specialized massage techniques, occupational therapy, lymphatic drainage, and pneumatic compression pumps. And I have some images of lymphedema. Here you can see the stages getting progressively worse with the swelling. And down here, the lymph vessels and lymph nodes, you can also see getting progressively worse with the swelling. And then I also created a little visual to help you better understand. So I have two different images. On this side, this is normal. We have normal lymph vessels and lymph nodes. Everything's working correctly. There's no blockage, and the lymph fluid is getting excreted as it should. So there's no problem. On this side, we have the lymph vessels and lymph nodes, but there is blockage. That blockage could be caused by infection or cancer or removal of the lymph node. So you get the blockage, the lymph fluid cannot be excreted as it needs to be. There's still the toxins and the waste, and therefore the tissues are getting swollen. So you can see the difference. There's more tissue, it's swollen. So hopefully this visual helps you understand even a little bit better what's happening. And then here are my references. I looked up many sources about lymphedema and about Kathy Bass and her struggle with it. So those are my references. And that concludes my presentation. Thank you for watching. I hope you thought my presentation was interesting and enjoyable, informative, and you understand more about lymphedema now. So thank you.